Hello guys, this is Lily and welcome to my YouTube channel. In this video, I will be talking about a treatment plan for the condition diabetes mellitus. By definition, diabetes mellitus is a chronic condition that results in problems with carbohydrate, protein, and fat metabolism. Okay, the insulin produced in the pancreas released into the bloodstream to facilitate sugar, which is the glucose absorption at the cellular level, right? So there are two types of diabetes. One is the type 1 diabetes mellitus, which is the insulin dependent diabetes mellitus, and it is a juvenile diabetes which is usually associated with dysfunction in the pancreas resulting in insulin deficiency. The other type is the type 2 diabetes mellitus, which is a non-insulin dependent diabetes mellitus. Okay, this is a disease in which your body cannot make enough insulin, which is a hormone that helps control the amount of glucose or sugar in your blood, or does not properly use the insulin it makes. Okay, so insulin helps carry glucose, also called sugar, to your cells. Here you go, guys. So when there is a problem with the insulin, glucose builds up in your blood. Okay, so you have probably heard this called high blood sugar. You have probably heard this, that is called high blood sugar. Okay, so about 90% of people who have diabetes have type 2. Okay, the other two main ones are type 1, in which your body stops making insulin, and gestational, which happens in pregnant women. Okay, so you can usually control type 2 diabetes with lifestyle changes. Some people also need medication. Okay, so you might not know that you have type 2 diabetes until it affects your health. Okay, so about 1 in 4 people with the condition do not know that they have it. There you go, guys. Let's talk about the type 2 diabetes in children. So type 2 was once called adult onset diabetes because it was rare in children and teens, but it has become more common since the mid 1990s, in large part because more young people are overweight or obese, a risk factor for the disease. Okay, so children are also at higher risk of type 2 diabetes if they do not get enough exercise or if they have a close relative with the condition. Okay, so African American, Hispanic, Native American, Alaska Native, Asian American, and Pacific Islander children are more likely to get it. Here you go, guys. So type 2 diabetes in older adults. Okay, your risk of type 2 diabetes goes up as you age because your body can become resistant to insulin and your pancreas might not work as well as it used to. Okay, diabetes is more likely to cause complications in people people who are 65 and older, especially heart attacks, eye problems, loss of a leg or amputation, and kidney disease. Here you go, guys. Let's move on to the causes of type 1 diabetes. So type 1 diabetes causes, the exact cause of type 1 diabetes is unknown. Okay, usually the body's own immune system, which normally fights harmful bacteria and viruses, mistakenly destroys the insulin producing the islet or islets of Langerhans, the cells in this islet of Langerhans in the pancreas. Okay, other possible causes include, which is the genetics and exposure to viruses and other environmental factors. Okay, these are the causes for type 1 diabetes. Now the causes for type 2 diabetes. So your pancreas makes a hormone called insulin. It helps your cells turn glucose. Okay, insulin helps the cells turn glucose, a type of sugar from the food you eat into energy. Okay, so insulin helps turn glucose. It's the sugar, a type of sugar that converts it into energy that your body uses for most activity or for metabolism. Okay, people with type 2 diabetes make insulin, but their cells do not use it as well as they should. Okay, so type 2, the pancreas can make insulin, but the cells of the body does not make use of it. Okay, so that's why there's a problem, right? So at first, your pancreas makes more insulin to try to get glucose into your cells, but eventually it cannot keep up and the glucose builds up in your blood instead. Okay, so that's how it is. So there are other causes like the genes. Scientists have found different bits of DNA that affect how your body makes insulin. Okay, so another one is the extra weight. Being overweight or obese can cause insulin resistance. Here you go, guys. Especially if you carry your extra pounds around your middle. Okay. There's metabolic syndrome as well. People with insulin resistance often have a group of conditions including high blood sugar, extra fat around the waist, high blood pressure, and high cholesterol and triglycerides. Okay, so too much glucose from your liver. Okay, when your blood sugar is low, your liver makes and sends out glucose. After you eat, your blood sugar goes up and your liver will usually slow down and store its glucose for later. But some people's livers don't. They keep cranking out sugar. Okay, so bad communication between cells. So another cause. Sometimes cells send the wrong signals or don't pick up messages correctly. When these problems affect how your cells make and use insulin for glucose, a chain reaction can lead to diabetes. Okay, another is broken beta cells. If the cells that make insulin send out the wrong amount of insulin at the wrong time, your blood sugar gets thrown off. High blood sugar can damage these cells too. Okay, let's go to the risk factors. For type 1 diabetes, risk factors include family history. So anyone with a parent or sibling with type 1 diabetes has a slightly increased risk of developing the condition. Now there's the genetics. The presence of certain genes indicates an increased risk of developing type 1 diabetes. Okay, geography. So the incidence of type 1 diabetes tends to increase as you travel away from the equator. Okay, right? Age. Although type 1 diabetes can appear at any age, it appears at two noticeable peaks. The first peak occurs in children between 4 and 7 years old, and the second is in children between 10 and 14 years old. Okay, take note of this, guys. Risk factors for type 2 diabetes includes like certain things make it more likely that you'll get type 2 diabetes. The more of these that apply to you, the higher your chances of getting it are. Okay, some things are related to who you are. So your age, 45 or older, family, a parent, sister or brother with diabetes, ethnicity, African American, Alaska Native American, Asian American, Hispanic or Latino or Pacific Islander American. Okay, so ethnicity. All right, so let's move on to the symptoms. Okay, symptoms for type 1 diabetes mellitus, which is the insulin-dependent diabetes mellitus, or blood sugar levels fluctuate often and include high levels, the hyperglycemia, which is excessive glucose in the blood, and very low levels, which is hypoglycemia, glucose in the blood or in the bloodstream. Okay, so excessive thirst, which is polydipsia. Polydipsia means excessive thirst. Frequent urination. Okay, there's bed wetting in children who previously did not wet the bed during the night. Okay, so there's irritability and other mood changes. There's blurred vision, glucose and ketones in the urine, presence of those, which is the another name is glucosuria or ketonuria. So glucosuria is presence of glucose in the urine, and ketonuria is presence of ketones in the urine. Okay, so there's extreme hunger, which means polyphagia. Okay, so unusual weight loss, which normal or increasing eating. Unusual weight loss with normal or increasing eating. Next is extreme fatigue, tiredness. Okay, sweet smelling breath, nausea or vomiting. Okay. For type 2 diabetes mellitus, non-insulin dependent diabetes mellitus, this condition has a gradual onset and may be asymptomatic, no symptoms, and may remain undetected. Okay, so symptoms, you get more thirst or more thirsty. Okay, when sugar builds up in your blood, your kidneys work overtime to get rid of it. This pulls fluid from your tissues and makes you dehydrated, so you feel thirsty. Okay, next, there's more hunger. Because diabetes can stop glucose from getting to your cells, you feel hungry even after you've eaten. Okay, that's another symptom. Peeing often. You'll pee more because your kidneys are working to get rid of extra sugar in your system. Okay, next, you get dry mouth. Dehydration and peeing a lot can drain moisture from your mouth as well. Okay, so weight loss without trying. When you lose sugar from peeing a lot, you lose calories too. You might lose weight even though you're eating as usual. Okay, another symptom. Fatigue. When your body cannot use energy from food, you could feel weak and tired. Okay, dehydration can make you feel this way too. Blurry vision. High blood sugar can make you have trouble focusing. Okay, headaches. High blood sugar levels can cause your head to hurt, so you're gonna get headache as well. So loss of consciousness. Okay, loss of consciousness after you exercise. After you exercise, skip a meal or take too much medication, your blood sugar could go too low and you could pass out. Okay, infections or sores that do not heal. High blood sugar can slow blood flow and make it harder for your body to heal. Okay, guys, tingling hands and feet. Okay, type 2 diabetes can affect nerves in your hands and feet. All right. Red, swollen, tender gums. You might be more likely to get infections in your gums and the bones that hold your teeth in place. Your gums may get infected or pull away from your teeth, so your teeth might become loose. Okay? So there are other types of diabetes. One is impaired glucose tolerance. Is defined as 2-hour glucose levels of 140 to 199 milligram per dl, 7.8 to 11 micromole mmol on the 75-gram oral glucose tolerance test. And impaired fasting glucose is defined as glucose levels of 100 to 125 milligram per dl, 5 5.6 to 6.9 micromole or mmol per liter in fasting patients. Okay, so there's another one. The gestational diabetes mellitus (GDM) is defined as any degree of glucose intolerance with onset or first recognition during pregnancy. The definition applies whether insulin or only diet modification is used for treatment and whether or not the condition persists after pregnancy. So there are complications of diabetes or diabetes mellitus. For type 1 diabetes, over time, type 1 diabetes complications can affect major organs in your body, okay, including heart, blood vessels, nerves, eyes, and kidneys. Okay, take note of this, guys. Maintaining a normal blood sugar level can dramatically reduce the risk of many complications. Eventually, diabetes complications may be disabling or even life-threatening. Okay, so you have the heart and blood vessel disease. Okay, that's one complication. Diabetes dramatically increases your risk of various cardiovascular, so heart and vessel problems, including coronary artery disease with chest pain, the angina, heart attack, stroke, narrowing of the arteries. Okay, so the arteries getting narrowed, which is the atherosclerosis. Okay, and high blood pressure. Okay, nerve damage, neuropathy. Okay, excess sugar can injure the walls of the tiny blood vessels, the capillaries, that nourish your nerves, especially in the legs. This can cause tingling, numbness, burning, or pain that usually began at the tips of the toes or fingers and gradually spreads upward. Poorly controlled blood sugar could cause you to eventually lose all sense of feeling in the affected limbs. Okay? Damage to the nerves that affect the gastrointestinal tract, your stomach and colon tract, can cause problems with nausea, vomiting, diarrhea, or constipation. For men, erectile dysfunction may be an issue. Okay, guys? Next is kidney damage, nephropathy, sorry. Nephro means kidney, pathy means condition or disease. Okay, the kidneys contain millions of tiny blood vessel clusters that filter waste from your blood. Okay, diabetes can damage this delicate filtering system. Severe damage can lead to kidney failure or irreversible end-stage kidney disease, which requires dialysis or a kidney transplant. Eye damage. Diabetes can damage the blood vessels of the retina, diabetic retinopathy. Okay, that's the condition's called. Okay, potentially causing blindness. Diabetes also increases the risk of other serious vision conditions such as cataracts and glaucoma. There is foot damage. Nerve damage in the feet or poor blood flow to the feet increases the risk of various foot complications. If left untreated, cuts and blisters can become serious infections that may ultimately require toe, foot, or leg amputation. Okay, skin and mouth conditions. Diabetes may leave you more susceptible to infections of the skin and mouth, including bacterial and fungal infections. Gum disease and dry mouth also are more likely. Right? Next is the pregnancy complications. Okay? High blood sugar levels can be dangerous for both the mother and the baby. The risk of miscarriage, stillbirth, and birth defects increases when diabetes isn't well controlled. For the mother, diabetes increases the risk of diabetic ketoacidosis. diabetic eye problems, retinopathy, pregnancy-induced high blood pressure, and preeclampsia. Okay? For type 2 diabetes, it is important to get your blood sugar under control to avoid these serious conditions. There's the hypoglycemia. If your blood sugar falls below 70 milligrams per deciliter mg/dl, it can lead to accidents, coma, and death. DL means deciliter. Okay? Hyperglycemia. Blood sugar that goes above 180 to 200 milligrams per deciliter can get your heart, nerve, kidney, and vision problems. Can give you, heart, nerve, kidney, and vision problems. Over the long term, it also can cause coma and death. Over time, people with type 2 diabetes may have other health problems. So one is diabetic ketoacidosis. When you don't have enough insulin in your system, your blood sugar rises and your blood breaks down fat for energy. Toxic acids called ketones build up and spill into your urine. It can cause coma and death if you do not treat it. Okay, next is the heart and blood vessel diseases. Okay, people with diabetes are more likely to have conditions like high blood pressure and high cholesterol, which play a role in heart disease. Also, high blood sugar can damage your blood vessels and the nerves that control your heart. Okay, high blood pressure. Diabetes doubles your risk of high blood pressure, which makes you more likely to have heart disease or stroke. Okay, the nerve damage, which is diabetic neuropathy. Okay, diabetic neuropathy. It can cause tingling and numbness, most often in your feet and legs. But it can also affect your digestive system, urinary tract, blood vessels, and heart. Okay, there's eye damage. Diabetes can cause glaucoma, a buildup of pressure in your eyes, cataracts, a cloudiness of your lens, retinopathy, which is damage to the blood vessels in your eyes. Okay. Now there's kidney disease. Your kidneys may have to work harder to filter out the extra sugar along with all the other waste products in your blood. Okay, so you get hearing problems. Doctors aren't sure why this happened, but they think high blood sugar levels damage the small blood vessels in your ears. So you get skin problems as well. Diabetes can cause infections on the skin. You're most likely to get bacterial and fungal infections. Okay, itching causes include infections, dry skin, and poor circulation. You may notice it in your lower legs. Okay, acanthosis nigricans. Okay, these velvety darker areas can appear on your neck, armpits, groin, hands, elbows, and knees. Okay, so diabetic dermopathy. This is in connection with skin. Changes to small blood vessels that look like red or brown scaly patches. They often show up on your feet and the fronts of your legs. Okay, and necrobiosis, lipoidica diaticorum. This rare condition also affects your blood vessels. It starts as a dull red raised area but winds up as a shiny scar with a violet border. Your skin could itch or crack open. Women are more likely to get this than men. Okay? Allergic reactions. You could get this in response to insulin or other diabetes medication. Now there is the diabetic blisters, bullosis diabeticorum. These sores look like burn blisters and can show up on the backs of your fingers, hands, toes, feet, and sometimes legs or forearms. So there is this disseminated granuloma annulare. Okay, you might get red, brown, or skin-colored rings or arc-shaped raised areas on your fingers, ears, or trunk. Okay, so let's move on to part 2, which is the subjective component. This includes your health history questions. So you're gonna ask your client all these questions. So one is, what is the person's general health, particularly heart, vascular system, the kidney health? Okay, so when was diabetes diagnosed? What type is it? Okay, then how is the diabetes controlled? If through insulin use, where are both old injection sites and new injection sites on fragile skin? Next question, is the client stable? Are blood sugar levels checked regularly? When was client's most recent crisis? Does the client have stable diet and regular sleeping habits? Is there any alcohol consumption? Does client exercise, and does exercise change the insulin requirements? How are the client's tissue health and gangrene risk? Is there any indication of the peripheral neuropathy? Okay, so the nerve diseases or problem. Are there any motor problems? Okay, is fainting or postural lightheadedness experienced that may be a concern for the client getting off the massage table safely? Prior to the treatment, does the client not eaten within the last hour? Experience a stressful situation, recently changed injection site, or perform exercise or strenuous activity, any of which may increase the risk of hypoglycemia. When it comes to injection sites, guys, the precaution for this is that you don't massage the area at least around 4 inches from the injection site. So you have to avoid the injection site area when you are okay to massage the client with this condition, if it's safe to do so. Okay, so when it comes to massage, if the client is taking medications and the diabetes condition is controlled, then you have to do to do the precautions in continuing with the treatment or continuing with your massage. Okay, so let's go to the next, the part 3, which is the objective component. Now this involves the assessment on the client. Okay, so for your assessment, it includes observation. Now you're going to be doing a postural imbalance observation. So observe client postural imbalances. If the client has kyphotic posture on the neck, like forward head carriage, or on the lower back, like if the client has hyperlordosis, or there's a deeper curve on the lower back, or if the shoulders are not even, like any postural imbalances. Okay, so next you're gonna assess the client for gait imbalance, which is the walking phase, or how the client walks. If there's any problem of the client in walking, so observe client postural imbalances in the walking. Okay, in the client's walking phase, so you have to observe that. Now you're gonna do palpation. Okay, so you have to palpate the client's lower legs and determine if there is swelling and muscles based on client's complaint. Okay, so swelling on the muscles based on the client's complaint. Okay, so you have to do palpation. Now for the testing, you have to ask the client regarding, you have to test the client as per client's complaint. So whenever area the client is complaining about, then that's where you do your testing to check for any problem, what's causing the problem on on the area that the client is complaining about. Okay, so once you're done for your testing, you're gonna do range of motion, so movements of the area of the joint or the limb that the client has complained about. Like deep tendon reflexes, you're gonna get the tendon reflex on the affected area. Myotome testing, you're gonna do this as well. Check for any abnormality, okay, on the affected area. Dermatome, okay, you're gonna do this testing as well. Blood pressure, gonna get the blood pressure reading on the client, and you're gonna do some special test. Okay, the special test is according to the client's complaint as well. So whatever the client's complaint on the area in the body where it is, then you're gonna do your special test to check, to assess for more discomfort, pain and discomfort. Okay, so myotome is testing the sensation of a group of muscles, whereas a single spinal nerve innervates, or there is spinal nerve, you know, on that group of muscles. Okay, so the innervation of the spinal nerve, okay, going through the group of muscles. Now the dermatome, it is the testing of the sensation of on the area of the skin where a single nerve from the spinal nerve innervates. Okay, so you're gonna be testing that for the assessment of the complaints of the client. Okay, now let's move on to the contraindications. So massage is contraindicated if the client is confused, okay, pretty much. Lethargic, okay, lethargic if the client is not feeling okay. Exhibits changes in mental function if the client is not really, feeling good and exhibiting some mental changes in mental function. And an immediate referral to his physician is necessary. So when a client comes to your clinic and you assess, you notice all these symptoms, the client is confused, is lethargic, and there's some mental changes or function, then refer the client immediately to his or her family physician. Okay. Next, emergency care must be called immediately. Okay. So when it happens, and when you notice this confusion, lethargic, if the client's lethargic and then there's changes in mental function, then you have to call emergency, or emergency care must be called right away. Okay, so call emergency right away. Now, care must be taken when doing slow, deep diaphragmatic breathing with those who have IDDM. Okay, so, and with anyone with diabetes who is susceptible to ketoacidosis. We have mentioned this previously. Okay, and diaphragmatic breathing may actually change in insulin levels. Diaphragmatic breathing, so taking a deep breath in and deep breath out. So practice diaphragmatic breathing. Okay, a physician should be consulted with the consent from the client before any changes in breathing pattern are attempted. So here you go, guys. Okay, so if the client has hypertension or cardiac complications, massage therapy is contraindicated. So you're not gonna do the massage for this symptom. Okay, if a decubitus ulcer, there's like skin ulcer Okay, or gangrene is present. Gangrene is something like very and not good ulcer on the skin. It's like almost dead tissue. Okay, local and distal massage is contraindicated, right? So local massage means you cannot massage locally on the affected area. Distal massage, if the affected area, you cannot massage lower than the affected area. If the affected area is around the knee, for example, then you cannot massage. Distally means lower than the knee, so it's contraindicated. You can only massage higher than the affected area, so away, like higher, not lower than the affected area. Okay, so it's really contraindicated. Okay, if deep cracks are observed on the heels of the feet, the therapist should avoid using oil in this area. It may provide an avenue for infection. Be careful, guys, with this. Okay, techniques such as frictions or deep cross fiber petrissage are contraindicated. Okay, so deep techniques cannot be used if tissue health is compromised or sensory losses are present. So if there are presence of gangrene, the cubitus ulcer, like there's like ulcers or any skin, you know, any skin openings that you see, then you cannot do these deep techniques. Okay, and if the client is feeling like numbness and tingling sensation, then you cannot do those techniques. Hydrotherapy extremes are contraindicated in light of the possibility of decreased tissue health and sensory losses. There you go, guys. So hydrotherapy extremes, you cannot use too much cold hydrotherapy or cold compress or ice or cold packs, too much of that. And you cannot use extreme warm or heat hydrotherapy as well. It's very contraindicated. Okay, so avoid eucalyptus essential oil. So eucalyptus is not being used for, is contraindicated, which may lower blood sugar levels. So it's gonna lower more of the blood sugar levels if you use this. And avoid extreme hydrotherapy temperatures due to decreased tissue health. You go. Okay. Now let's move on to part 5, which is the treatment plan. Now you're gonna follow the goals for this. So just read on the information, guys. Now, for the positioning on the treatment is according to client's comfort. So you're going to check on the client's comfort for this, how to position your client during a treatment. The client may need help getting on and off the table, the massage table, or changing position if he experiences faintness or postural lightheadedness. Be careful, okay? And for hydrotherapy, so appropriated hydrotherapy is modified. So you have to modify it. If you feel like you need to use cold or warm hydrotherapy, then you have to modify the coldness or the warmness of the hydrotherapy use. Okay, so you're gonna modify according to the complications. So you're going to check on the complications of the diabetes if the client has diabetes, such as cardiac or tissue health problems. So if the client is having like cardiac problems like high blood pressure, and you're gonna check if the client is on medication, if it's safe to do massage, and if the client has like ulcers or skin openings, gangrene, like on the feet, those problems, then you have to be careful. Okay, you have to modify if you want to use hydrotherapy. Now the next is specific treatment, right? So these are the specific treatment that you can follow. Just read on the information, guys. Okay, so the part 6, which is the self-care, we have goals to follow as well, so just read on the goals, guys. Okay, so let's move on to the treatment frequency. So suggest once a week for 2 weeks, okay, then reassessment after, followed by the next treatment for once in every 2 weeks for 2 treatments, then once a month thereafter, depending on the progress of the client and availability. Okay, so the expected outcomes from the treatment: client overall relaxation. Okay, you're gonna expect that. Being able to do activities of daily living and maintaining tissue health. Okay, these are the expected outcomes that you are gonna, be able to help the client with your treatment. Okay, so here you go, guys. This ends our video for today. Thank you for watching. Please subscribe, like, comment, and share this video. Again, thank you very much for watching. You have a great day.